Hello, I'm Dr. Noelle Jacqueline, Director of NJ4S at Acenda Integrated Health.
And I'm Laurie Smith, Assistant Director, NJ4S at Acenda Integrated Health.
Welcome, Atlantic and Cape May counties, to the 15-minute Child Break.
Thank you so much for joining us today.
The video you're about to watch is designed to provide you with valuable information on current substance use-related issues and trends that impact the children in your life.
From the importance of mental health to the latest drug trends, this video will give you the tools and knowledge you need to have meaningful conversations with your children, whenever and wherever the opportunity arises, to help prevent substance use.
Across New Jersey, marijuana remains the most commonly reported illicit drug among adolescents, followed closely by alcohol.
Here in Cape May and Atlantic counties, we are facing some of the highest overdose rates in the state, along with a continuing rise in vaping among our youth.
If we at NJ4S can be of any assistance to you and your families, please visit our website for resources, support, and additional information.
Thank you for taking the time to watch this video and for being proactive in helping the children in your life grow up to be their healthiest, happiest selves.
Together, we can make a positive difference in our communities.
Hello, and welcome to the Partnership for a Drug-Free New Jersey's 15-minute Child Break. Thank you for taking the time to participate in this webinar. We are here to talk to you today about the important role you play preventing underage drinking, trying an e-cigarette, or using marijuana or other drugs. You may not think it can ever happen to your child, grandchild, or someone you love. But sadly, substance abuse and addiction can happen quickly and without you ever realizing it. We do know the earlier children start using these substances, the more likely there is for a problem to occur. So the earlier you start talking to your kids, the better.
Hey, son. So, you're turning 13, becoming a man. Your hormones are surging, starting to notice the girls. You know, maybe your body's doing some funny things. So, you want to talk? Or we could talk about drugs.
Yeah, let's talk about drugs.
There's no wrong way to talk to your kids about drugs. Need help? Get help. Visit our website at drugfree.org.
Research completed by the Partnership for a Drug-Free New Jersey demonstrates that communication is key. Parents who talk to their children at least 15 minutes a day have children who are 67% less likely to experiment with drugs. Think about that. Engaging in meaningful conversations with your children while driving them to school or while sitting at the dining room table on a regular basis greatly reduces the risks of trying alcohol, e-cigarettes, or other drugs.
What would you do if a stranger talked to you?
I wouldn't talk to them because it might be bad.
Very good. And what would you tell someone playing with matches?
I would tell them not to play with them because they might start a fire.
Wow. How come you know so much?
My mommy told me.
Oh, and what did your mommy tell you about drugs?
Your children are listening. Are you talking?
How early is too early to talk to my child about drugs, alcohol, and substance abuse prevention? Our answer is to start as early as your child is ready, using age-appropriate examples and language, and to have the conversation at least by the time your child is in the 3rd grade. It doesn't matter how you choose to talk to your kids about substance abuse. It just matters that you do. You can make it conversational so it will be less awkward. Even if you think your kids aren't listening, they are. Being involved with your kids as much as you can is an important part of your role in prevention. Knowing that you are available and accessible is important so kids know you are always there to talk.
What would you say if your child were approaching something this dangerous? And yet, with something as damaging as drugs, millions of parents say nothing. Say something.
This chart shows what we are facing today in terms of drug and alcohol abuse among different age groups. Some good news is that we have seen a steady decline of regular use of alcohol and also binge drinking. Marijuana use and vaping are next. And the abuse of prescription drugs is also very concerning. Let's now take a look at what's going on in our middle schools. If you are thinking that you can wait until high school to talk to your kids about drugs and alcohol, you should think again. This data comes from New Jersey middle school students. Too many parents wait until high school to address this subject. You need to be talking to your children about drugs and alcohol before they have a chance to start. Our kids today are stressed. On the right side of this chart, you see what many parents are thinking when it comes to why kids try drugs or alcohol, to fit in or feel cool. Those are valid reasons. However, what many parents are overlooking is how stressed out our kids are today. Many feel pressure over schoolwork, family issues, relationships with friends, and social media. As parents, you need to teach your children that stress is a part of everyday life, no matter how old you are. There are healthy ways to handle stress and unhealthy ways to deal with it.
These opioids, let me tell you something the statistics show. If you are taking opioids and you fill your prescription one time, your likelihood of being addicted at the 1 year mark is 1 in 7.
Wow.
Yeah.
If you are still taking your prescription at the 30-day mark, your likelihood of being addicted at 1 year is 34%, 1 in 3.
Yep.
That's how powerful this is. And I'm going to tell you that it is a different pathway than other addictions, so the treatment is very, very difficult. It hijacks the brain's, it shuts down the brain's use of endorphins. So you stop secreting endorphins, manufacturing endorphins, that suppresses pain. So when you start taking this pain medication, your body stops doing it on its own.
Yeah.
And oftentimes these people that have been on these opioids for a long time, when they stop taking them, the endorphins kick in and the pain goes away.
Yeah.
Wow.
It just goes away when you stop taking the pain medication.
Oh.
So, and there's a paradoxical effect to opioids. Where you take them a long time, you start getting sensitized to pain.
Yeah.
So there's all kinds of problems with this, and it is an epidemic.
Yeah.
It's easy to hide.
This is the worst drug addiction epidemic in United States history. We have never experienced anything like this before. It's the worst epidemic when you measure the number of people who are dying of overdoses, and it's the worst epidemic we've ever experienced when you look at the total number of Americans affected. Opioid pain medicines are drugs that come from opium. Hydrocodone, which is Vicodin, oxycodone, which is an OxyContin. We would call them semi-synthetic because you start with something natural. Heroin, obviously, also comes from opium. Heroin is also semi-synthetic. The effects that hydrocodone and oxycodone produce in the brain are identical to the effects produced by heroin. An experienced heroin user can't tell the difference between one or the other. And so when we talk about opioid pain medicines, we are essentially talking about heroin pills.
Some patients may be afraid of taking opioids because they're perceived as too strong or addictive. But that is far from actual fact.
The reason we're experiencing an epidemic of opioid addiction in the United States is because the doctors started to prescribe opioids much more aggressively.
Since I've been on this new pain medication, I have not missed one day of work, and my boss really appreciates that.
We were responding to a brilliant marketing campaign that had been launched mostly by Purdue Pharma, the maker of OxyContin, in 1996 when it put the drug on the market.
It's not acceptable to say, I don't believe in using strong pain medications.
Doctors in the United States started to hear that we had been under-prescribing opioids, that we were allowing patients to suffer needlessly because of an overblown fear of addiction.
I feel as though the opioids have given my life back to me.
You can be more compassionate if you prescribe more opioids. And as we responded to this campaign and the prescribing went up, it led to a public health catastrophe. Some states have passed laws limiting first-time prescriptions. Most states have gone with a 7-day limit. New Jersey went with a 5-day limit. A 5-day supply of opioids should really be more than enough for the vast majority of patients who might need an opioid prescription because they just had major surgery or serious accident. If a patient has pain so intense that they need more than a 5-day supply, there's probably a good reason for that patient to be evaluated by their medical provider. And New Jersey did something else that was unique. They passed a law mandating that prescribers warn patients that opioids are addictive drugs when they prescribe them. You have many people who are prescribed opioids or their children are prescribed opioids and they have no idea that this is a drug that's as addictive as heroin. It's likely that if parents or even the prescribers understood how addictive these drugs were, they would be prescribing more cautiously.
As a parent, you need to understand that there is a direct link between the opioids children are being prescribed by their doctors for sports-related and other injuries and becoming addicted to them. Since the chemical makeup of opioids and street heroin are the same, our kids are very much at risk. Teens who are prescribed an opioid before graduating from high school increase their risk of future abuse by 33%. Dentists are the #1 prescriber of opioids to adolescents. The U.S. is only one of a few countries that are prescribing these potent painkillers for dental surgery. If your child is undergoing a dental procedure, this is important to keep in mind. The Centers for Disease Control and Prevention report tells us that every 19 minutes, someone dies of a prescription drug overdose. These medicines, which are designed to save lives and which we all have in our homes, can have disastrous effects when abused. Children sometimes gain access to these medicines in their own homes, or the homes of their grandparents or their friends' homes. Some young people will use them alone to self-medicate. Others will bring the medications to share in what are called farm, bowling, or Skittles parties. They toss the pills into a bag, container, or box. Then they reach in, pull out a random medication, and take it. To address this issue, we need to change the traditional way medication is stored in our home. We encourage families to participate in the American Medicine Chest Challenge. This initiative outlines 5 steps to safeguard your home to help prevent prescription drug abuse. Many teens are vaping, but do not understand that there is nicotine in the products they are using. Almost 6% of our kids are vaping marijuana. By 12th grade, more than 20% of students have reported using vaping products. There has been a surge in vaping. The U.S. Surgeon General reports a 900% increase in vape and e-cigarettes use in the last 5 years.
E-cigarettes, vape pens, Juuls. They're often marketed as safe alternatives to smoking, but their cool designs, fun flavors, and the fact that they're easy to hide means it's not only smokers who want them, it's kids. And for kids, they're definitely not safe. Teens should absolutely not use Juuls, e-cigarettes, or any similar products. Here's why. When kids use Juuls or other e-cigarettes, they're getting a big dose of nicotine. This disrupts their brain development. It changes the connections between brain cells, causing problems with learning, mood, and impulse control. It makes depression and anxiety worse.
And as any smoker can tell you, nicotine is highly addictive. That makes it very difficult to quit e-cigarettes. And vaping makes it much more likely that kids will smoke real cigarettes later. It's true that a few e-cigarette brands don't contain nicotine, but most of them do. And all of them contain other dangerous chemicals like these. Formaldehyde, which is found in glue and embalming fluid. Diacetyl, which causes lung disease. Benzene, that's a carcinogen linked to leukemia. Some tests have also found metal particles in the e-cigarette vapor. The devices themselves can also be unsafe. They can explode.
The long-term effects of using e-cigarettes are unknown.
And because there are no standards, we don't know the ingredients in these products.
We don't want children to take unnecessary risks with their health
And begin a lifelong addiction to nicotine. Talk to your kids about e-cigarettes and how to say no to these harmful products.
Here is some of the data we have since vaping and e-cigarettes use has exploded over the past 5 years. Electronic cigarette vaping-associated lung illness has become more and more prevalent. Thousands of individuals, mostly teenagers and young adults, have needed medical treatment for this vaping-related illness. The Center for Disease Control has noted that most illnesses, 80%, seem to be the result of illicit products containing THC and vitamin E acetate. The problem seems to be occurring as the result of inhaling the product, which impairs normal function of the lungs. New Jersey instituted a ban on flavored e-cigarette and vaping. But please note that these products will still be available on the street for your kids to get their hands on them. A hooded sweatshirt makes it easier for kids to hide their face if they are vaping. It is even possible to hide the vape pod inside the string hole of the sweatshirt so no one will notice. This is a backpack your teenagers can buy off the internet that has a small compartment for hiding vaping paraphernalia.
Hey.
Dad, what are you doing?
What am I?
A burrito?
No.
A larva?
A larva? No. I'm a joint.
Actually, you're a little too fat to be a joint.
So you know about joints?
There's no wrong way to talk to your kids about drugs. Need help? Get help. Visit our website at drugfree.org.
Talking to your kids about marijuana has become more and more challenging for parents today. Many states having passed recreational use of marijuana for individuals over 21. This can be confusing for kids.
Hey, Ellen, want a hit? Want to smoke a joint before trying this on?
Here you go, Ellen. You want to get high? We got some great Thai stick in the back.
Smoke. Smoke. Kind buds. Sensei. You're gonna love this stuff. It'll get you really high.
In comparison to 20 or 30 years ago, the marijuana that is available today is much more potent, containing much higher levels of THC, the psychoactive component in marijuana that gets you high. Additionally, most young people today are not smoking pot or rolling joints, but are using vaping devices to smoke marijuana. Let's look at the science of marijuana's impact on the developing brain. Marijuana has a negative effect on brain development. Regular use often results in students not doing well in high school and can lead to use of other illicit drugs. Clearly, marijuana does not work well for the teen brain.
Hi, Patsy here. Today I'm going to show you a place where you can talk to your kids about drugs without any distractions.
How are you doing?
Kevin, do you know what weed is?
Get out of here, I'm naked.
Can't take no for an answer. Kevin, do you know what weed is?
You're so lame, get out.
Getting their attention's half the battle. We did that. Great progress here, guys.
Get out!
Don't be a patsy. Learn a better way from the partnership and our community partners.
It is never too early to start the conversation. Drugs and alcohol can cause a lot of damage in our kids' lives. Alcohol remains the primary drug of choice for our young people. Alcohol clearly impacts your child's brain development and interferes with memory. Our brains are not fully developed until our mid-20s. Research shows that 50% of those who develop an alcohol use disorder in our country met the criteria before age 21.
Anyone else?
My name is David, and in 8 years, I'll be an alcoholic.
Hi, David.
I'll start drinking in middle school, just at parties. But my parents won't start talking to me about it till high school. And by then, I'll already be in some trouble.
Kids who drink before age 15 are 5 times more likely to have alcohol problems when they're adults.
The thing is, My parents won't even see it coming.
So start talking.
Who's next?
Before they start drinking.
There are warning signs to look out for if you suspect your child may be using drugs or alcohol. The most prominent physical signs are slurred speech, glassy eyes, and skin abrasions. Some behaviors to be aware of are changes in mood, eating, or sleeping patterns, as well as fighting with family or friends. You should also look out for depression, loss of motivation, or frequently nodding off. If you think something might be going on, do not be nervous to talk to your child. We also encourage you to speak with experts in the field. Call your substance awareness coordinator, your guidance counselor, or the school nurse. Many parents we talk to wish they had reached out sooner rather than later. Let's now take a look at protective or positive attributes that factor into deterring your child from drug or alcohol abuse. These factors are based in how your child views and feels about themselves, their peers, and their environment. They include having a healthy concept of themselves, their friendships, their school, and extracurricular activities. As parents, you should monitor what your child is doing on his or her free time and who they are spending time with. Research done at the Partnership for a Drug-Free New Jersey has shown that having a meal with your children is good prevention, as it allows time for meaningful conversation. So if the Sunday dinner has gone by the wayside, bring it back. It may be tough between work and other responsibilities you have and the busy schedules your children have to find the time, but making an effort to have a family meal as often as you can is a great way to connect with your kids. It is never too early to start talking to your kids about drugs and alcohol. The American Academy of Pediatrics recommends start talking to your children about this issue at age 9. If you are coming up blank with how to begin the conversation, perhaps you can use examples of things going on in your own life that are stressful and how you are handling them. Or maybe talk about things you heard that are going on at school or in town. Whatever it is, anything that you think might help to get the conversation going is worth trying. A simple 15-minute conversation each day can make a huge difference. Just being present and doing things with your kids is important. It lets them know that you care and you are invested in them. With all the social and academic pressure our kids face, it is important to build up their self-esteem and provide unconditional love. A simple 15-minute conversation each day can make a huge difference. Having realistic but firm rules on underage drinking and other drug use is essential. As hard as it may seem, you should never think that drug and alcohol abuse is something that your child wouldn't engage in. Knowing the signs is important, just as knowing what to do in advance, or if you feel something just isn't right. Thank you for your participation today. And remember, parents, you are the anti-drug for your children. Talk to your children about alcohol and drug abuse. They are listening. Thank you.